So welcome to this session today. We are to discuss the concepts of consumer behavior in healthcare marketing. So we're going to look at consumer behavior in healthcare marketing. And in this session, we'll be able to explain how consumers make decisions related to health, to health seeking behavior. And then we'll see the factors that actually influence consumer behavior in healthcare. And then lastly, we'll explore how the psychological factors, the social factors can be changed in favor of or in enabling consumers seek for the services that we offer in our different healthcare organizations. So if you are selling something, if you're marketing healthcare services, you need to understand how people make the decisions on buying your services and products. So how do they make that decision? If you understand the processes or the stages through which they go through in making those decisions, then it means that you'll be able to design effective marketing strategies to satisfy their needs. So we are going to look at the consumer decision-making process, and we said that consumers go through 5 stages in making a decision related to healthcare. The first being the need or problem recognition, and then the second being information search, and then evaluation of alternatives, and then they now make the decision and purchase the healthcare service or product. And then the last one, which is basically after them buying, how do they behave? So that is the post-purchase behavior. Okay, so when you're doing your marketing activities or planning, you should understand that they go through all these stages, and then your role is to determine what strategies you have to use at what stage. Okay, for example, some people may have a health problem, but they don't know that they have that health problem, or they don't know that they can be helped with a particular health problem. Okay, so at that point, you need to let them know or recognize that they have a problem. Okay, and so on and so forth. So that is the first step, problem recognition. At this stage, they realize that they have a problem and that they need to seek for medical care. So the factors that influence that recognition can be related to internal factors, that perhaps that a particular condition is causing them to experience symptoms, for example, pain, and then that's when they realize that they have to seek for medical care. Okay, sometimes after running a radio talk show or using different mass media platforms, that's when they can get the message that they have a problem that they need to deal with. Okay, so that's needs recognition. After that, maybe they have not got enough information about the health problem through that prompt that you have offered them. Then they can go and look for more information. That is stage 2. They can ask health workers. They can do some research online. They can ask friends or family members about the disease or the health problem they are facing. Okay, so this is where you also need to make yourself available as an organization when people are seeking for information. For example, if it is about a given surgery, if you have content related to that surgery, then it means when they are searching, then they should be searching online, then they can be able to get you. Okay, so that is second stage. The third stage is now they have gathered this information from different people. Now they need to make a decision. So that decision will depend on many factors. Okay, it could be about the quality of services offered in the different health facilities. They weigh that. They'll look at affordability, convenience, reputation, and recommendation. Okay, if it is a highly specialized skill, medical treatment, then they may have to follow recommendations of experienced or experts in the field, and they will follow those recommendations. Reputation has what is the image of the organization or the healthcare organization to the public? Are they known for being meticulous in their procedures? Okay, that's another issue. How convenient is the procedure or the affordability of the healthcare services in your healthcare organization? So after evaluating those options, now they make the final decision on what healthcare option they have to choose. So which healthcare organization are they going to go to carry out that procedure that they have chosen? Still, they look at factors that are also related to the evaluation. Okay, the final decision depends on the different evaluation criteria that the person has used. And then after procuring the service, that is maybe if it is about tooth extraction as the procedure. Now, the procedure has been done in your dental clinic, for example. Now, what happens afterwards is what we call the post-purchase behavior. This is very important because you are the healthcare manager and you need to maintain a positive. You need the clients who have purchased services from you to have a positive experience such that they can lead others to your health facility. So the other aspect also is that the moment they have another related problem, they should be able to come back to you. That is customer loyalty. So that is very important. They will refer clients, they will be loyal to you, and you establish long-term relationships with them, such that when they actually have, let us say, a child who is having a tooth problem, then they most likely bring that child to your dental clinic. And that means that you're actually going to be treating a generation, because different generations within that family. So for every contact that you have with a client, you have a possibility of growing from that point, and of expanding the number of clients that you have. That means if they have a positive experience when getting services from you, they will tell their wife. When their children get problems, they will refer them there. And then when their children also grow up and have children, they will take them there. So you have a generational, you're giving services to generations. So what factors influence consumer behaviors? You need to understand these factors properly. If you understand them, that's when you can be able to change them to your liking. Okay, so we have categorized the factors into three. We have the personal factors, the psychological factors, and then the social factors. So we're going to look at each of these. When we talk about personal factors, we are talking about issues to do with demographics, age, gender, income, education, health status, and then personal beliefs, values, and attitudes. So each of these actually have a way in which they influence consumer behavior in healthcare. So let's start with the demographics, which is basically having all the aspects that I've just listed. Age. Young adults will seek for healthcare services that are different from the elderly, okay? Because they are actually having, most likely having differing health needs, okay? And the way in which they actually take these services is also different, okay? How you want to influence their behaviors will also have to be different, because how they consume health information is also different, okay? So that means that their behavior is actually different because they have different health needs. The elderly may have more, they may have chances of getting non-communicable diseases, and they are treated in a chronic manner. And then you have young adults who are generally more healthy than the elderly. Okay, so their requirements are different. Okay, and then we have gender. We have some conditions which are more prevalent in one gender compared to the other, and therefore their health needs also are different. So that means, for example, if you're marketing breast cancer screening, your target could be more on females compared to males, because breast cancer is common in females than males. Okay, or for example, when you talk about cervical cancer screening, it means that your target is basically females and you're not going to include the males. Okay, then we come to income levels. Okay, the income levels. When we talk about income levels, we relate to the ability of the different consumers to purchase healthcare services. Okay, most likely those who have high income are more likely to purchase health insurance and are therefore more likely to seek medical care if they have medical problems, compared to people of low income status. And then we have education. With education, it influences what we call health literacy, which is basically that when someone is provided health information, they should be able to make decisions, appropriate decisions, based on the information that they have. But health literacy also is related to the level of education. If someone is not educated, they may find it difficult to get the right information, and therefore they may not make the right informed decisions about their health. And then we have health status. Individuals who have existing medical conditions are more likely to consult healthcare professionals. Okay, so it means that they can be able to make healthcare choices and priorities because of the fact that they have a pre-existing condition. Let us say they have diabetes, they have high blood pressure. With these conditions, for example, hypertension, it means that the person needs to make sure that they take their medication as prescribed throughout their life. And therefore, their health choices are different from those of an individual who does not have a existing condition. And then we have personal beliefs and attitudes. Okay, perception of medical care, whether preventive or alternative medicine, guide decision making. So whether one perceives themselves to be at risk of a particular disease or not, or whether they perceive the given treatment to work or not, all this will influence their behavior in seeking for medical services. So we move to the second category of factors, that is psychological factors. Perception is basically what you have just explained. When a person gets a disease or health problem generally, they have their own interpretation of what they are suffering from. If they don't believe that the condition can be treated from the health facility, they will not visit the health care facility. So perception plays an important role in many things. In accepting the diagnosis, or in accepting that they're actually sick, in seeking care and what type of care they're going to seek, whether it is alternative medicine or it is the conventional medicine, and whether they will adhere to the treatment or not. So that's perception. And then we move to motivation. Okay, some people are very concerned about having a better health, and that if they get any problem, they will always go and consult a medical doctor. Okay, others are motivated to seek services if the services are closer and they are offered at a good cost and they're actually convenient. Okay, then it is very easy for people to go and seek for medical care and therefore purchase health services. Then we move to emotions. People who are having positive emotions, these positive emotions encourage engagement with health professionals. But if an individual has negative emotions, it is very easy for them to withdraw from others, and therefore they may not seek for medical care. Okay, so people who have depression may actually be withdrawn from others and may not seek medical care or mental health care services. And then we have personality traits. We have individuals who can be able to take risks and explore alternative treatments. Okay, and then we have those who are actually very cautious in decisions that they actually make. So if it is about a surgery, they will say, no, I will not go for the surgery. And then you have those, if they're advised to have a surgical procedure and they are okay with that, and then they will go for that medical procedure. So it's about personality traits. And then consumer trust. Okay, if health workers are trustworthy, it is likely that patients will trust them and will always come and get advice or medical care from the health facility. But the moment that trust is eroded, the consumers or the patients will run away. And then risk perception. Okay, for example, you have different risks that you have that can lead someone to have a particular disease. But if a risk manifests in an individual and then they don't perceive that risk to be a serious risk, then they will not go to seek for health care. So that will influence whether they will purchase healthcare services or not. And then we have what you call self-efficacy, which is the belief that an individual has in their ability to manage health and therefore make informed decisions. Okay, so if someone has low self-efficacy, they tend to believe that they have no control over their health. Okay, but if they have high self-efficacy, then they believe that they have the ability to manage their health and therefore make informed decisions. You want that to happen. And then when we move to social factors, we're basically talking about family, friends, health workers, social norms, social support, and community influence. When someone is about to seek for medical care for an illness that they are suffering from, it is likely that the first people they will tell will be their loved ones, the family members. And then the family members will provide emotional support, offer advice, and often recommend the health worker that can handle that condition. And then the peers also will do the same. It's the same thing that the health workers, if they have friends who are doctors, the friends will also give recommendation, they will give emotional support, and they will give advice on where to seek for care, and actually provide more professional insight about the care that a particular person may need. Okay, so these three groups are very, very important before a person goes to seek for medical care. And then we have our social norms, values, support, and then community influence. These all play an important role in influencing consumer behavior in healthcare. When we talk about cultural norms, of course, there are many cultural practices that are related to health, disease, and illnesses. Okay, certain norms or cultural practices may not allow certain treatments. Issues to do, for example, with let us say surgeries or even blood transfusion and things like that. And then you have, so with that, as a healthcare manager or as a healthcare marketer, you need to understand the cultural aspects of the community you're serving in and be able to craft the appropriate messages for people, depending on what they believe in. And then social support is related to the family members that are close to you. If someone is sick, they need social support. They need to be supported in even some activities of daily living. So it is very, very important in enabling someone to make a decision whether to seek medical care or not. And then community influence. What resources are there in the community that encourage consumers to seek for healthcare services? The availability of health programs or initiatives within a given community will influence their individuals' abilities to go and seek for healthcare services. So having looked at the different factors that influence consumer behavior, we can now focus on the element of now implementing the real strategies, tactics, techniques in marketing. So this is where we are going. The first one we are going to look at is what we call market segmentation, which is that having understood that people are not the same, they make decisions based on very many factors. Now, you will not have messages going through all of them at once, and that is the same message that you're sharing. No. You have to understand what they need, who they are, and then send the messages that target who they are and what they actually need. That is an aspect of market segmentation. So market segmentation divides healthcare consumer populations into distinct groups based on their characteristics. Are they the elderly? Are they young adults? Who are they that you're really targeting? Are they those that are of high income class or low income class? That will determine the nature of services you're going to offer, the pricing, how you're even going to advertise. These are very important aspect. So you can divide the health consumer population based on demographics, that is either pediatrics, young adolescents, is it the elderly that you're targeting, or what? You can divide them according to their psychometric aspects, perception, motivation, emotions, and things like that. And then geographical location, urban or rural. What conditions are you interested in? Is it chronic conditions, diabetes, hypertension, and others, cancers, and things like that. So market segmentation is about dividing the consumer population into groups, and then you tailor messages for that specific group, because you don't want to send a uniform message to everyone. It will not work. It will not be effective. It will not be efficient. So what strategies can you do in targeting? Remember, we have just said that you want a specific group. So what can you do? You can do what you call differentiated marketing, concentrated marketing, or niche marketing. So we're going to look at each of these. Differentiated marketing is when you want to target different categories, but these different categories should have their own unique messages. Okay, so your hospital is not only looking at, let us say, the elderly. It's looking at children, the adults, and the elderly, and the rest. Okay, but to be able to reach to those different segments, you need to use different strategies. That's what we call differentiated marketing. So what are those approaches that you will use? If you want clients for pediatric cases, then your messaging should have the element of appeal to parents and caregivers. So whether you're using flyers, whether you're using television adverts, the parents or the caregivers, that appeal should come out. That messaging should come out. And then when you look at your physical infrastructure in terms of the healthcare organization, you need to make the hospital child-friendly. And being child-friendly, you have elements of decoration. How you do your design, your wall design, your beds, seating arrangements, all those things. What colors, what paintings do you have? Those elements in terms of branding are very important in sending the message that this is a good hospital for children. And then you have, if you're going to focus on young professionals, if you want to attract young professionals, for example, into the healthcare organization, then you need to demonstrate that your healthcare organization actually is very good to work in because of the use of technology, which brings about convenience. And that even young adults, if you're targeting them, that they can make an appointment online. Okay, they can schedule appointments online. If they have consultations that they can make, should be technologically driven. That is if you are targeting young adults or young professionals. And then if you're targeting the senior citizens, then your emphasis should be on your ability to offer geriatric care services. That means that your marketing material, which includes, of course, the brochures, what you post on social media, even your adverts, should reflect that the staff that you have in the health facility are seniors and they are experienced. Therefore, they understand health-related concerns of people who are aging. And then you should also reflect the fact that you can offer services to people in their homes. And then you can also actively seek out for partnerships with organizations that deal with issues to do with senior wellness or the elderly who may be on programs that will enhance wellness. And then an aspect of cultural inclusivity or cultural sensitivity, which if you live in or if the organization is in a location where you have diverse uh, um, ethnic groups, for example, diverse cultures, diverse tribes, race, it means that you need also to portray that in your branding, in your marketing. Okay, so it means that it can also be reflected in the staff of the health facility. Okay, that diversity should come out because that diversity is associated with cultural diversity and therefore cultural competence, which is very important. You can also engage the community. You can have programs, wellness programs, community events. You can participate in this. This will help in connecting you with the community, but also it enhances your reputation, but also demonstrates the commitment to community health. So the other two approaches for targeting that can be used in healthcare are concentrated marketing, which is now you have determined the segment that you want to focus on, and now keep tailoring your messages to that. Who has joined with their mics open? You make it complicated for us.
Oh, sorry. Good afternoon.
Yes, good afternoon. Make sure you mute, please. I'll give you time for questions and things like that. When you come with your mic open, it disorganizes our recording. Okay, so we're talking about concentrated marketing, which is that you have now chosen to serve a given group of people. This group could be maybe senior citizens, that is geriatric services. Now you tailor your messages towards that specific market such that you create a strong presence in the market. So you have a large share of the market share. Okay. And then you have what you call niche marketing. This one is smaller. You're targeting a smaller consumer segment with unique healthcare needs. Okay, this that actually means that you are more specialized. Okay, you are more specialized. You carry out specific procedures. Okay, and therefore it allows you to be extremely competitive, or you have to have that competitive advantage in the market because of the nature of services that you are actually offering. So that is niche marketing. It may be better for a healthcare organization to be known for few services than to be known for many services and you're providing them in a substandard way. With niche marketing, you're saying, I'm going to specialize in, let us say, for example, ENT, which is ear, nose, and throat, ENT clinic, and that is it. Those are the services you're offering. So you're only dealing with conditions of the ear, nose, and throat. So that is niche marketing. So we earlier on looked at the psychological factors And under the psychological factors, we looked at the motivation, what motivates people. We looked at emotions. Okay, those factors influence how people seek for healthcare services. So we need to understand these factors, this motivation, the trust, the emotions. How do we how do we determine that? We can carry out a number of studies to to get to know what people feel, or to get to know the psychometric parameters they actually have in relation to the health services that we are offering. So we can conduct interviews, focus group interviews or motivational interviewing, and then behavior analysis to be able to understand their behaviors or the motivations behind their behaviors. And when we know that, then that's when we can do market segmentation, or what you call psychographic segmentation. So if you want to change people's motivation, perception, moods, and emotions about a given healthcare organization, then you may need to do one, give them incentives, maybe give rewards, have social proof is when people actually people who have approved the healthcare organization. Or this is to say that people have a very good perception about, or very good reputation or perception about the healthcare organization. You can have a very good organization, healthcare organization, maybe a very good hospital, but when women go there for cesarean section, they die. It can happen, like let us say it happens twice in a year. Every time you talk about your woman delivering in that hospital, people will have people will question whether you're making the right judgment, because you have not jumped that social proof level. Okay, so that means that when you set up a hospital, you need to be aware of these dynamics, that at the start, you're against people in terms of you have to win people's trust. If you win people's trust, then you have social proof. Okay, so that means that the services that you offer, the modalities that you offer, that happen in your facility, how you handle complaints, what people say about your services, how your health workers behave. These are very important. So testimonies come in. If you have good testimonies, we have good reviews, then you have better outlook in terms of brand perception, in terms of customer loyalty, in terms of referrals. People will refer clients to you and things like that. So in order to influence those, you need to do those that I've actually listed. You need to educate people about the services that you're offering. Sometimes you need to persuade, but persuasion is on a borderline. Persuasion is on the borderline with ethics. That's why in one of our first lectures, we said that healthcare marketing has delayed to take shape. It faced a lot of resistance, and some of these tactics can be termed to be those that are going to the extreme. So persuasion may be a little bit hard to implement in healthcare. So you need to understand people's motivation, attitudes, beliefs, emotions, a lot of things. So you use a number of studies. Some of them I've mentioned them. Some of them are what I've just listed here, and you can do further reading on them. Attitude scale, semantic differential scales, Likert scales, conjoint analysis. This is at the moment where you really want to understand what beliefs, what attitudes, what perceptions people really have about your services. So that means that you need to know the tactics of influencing people's perception or consumer perception. There is nothing that goes beyond providing best healthcare services. That's the number one marketing tactic. If you provide affordable, quality healthcare services, then that's one of the major weapons that you can always use. But of course, proper branding, positioning, differentiation, advertising, and public relations are very important. In this session, you already looked at public relations in reputation management as a separate lecture, so that will not look at it. Positioning, we are looking at it in this session. You will have another session on branding and then advertising. Okay, but basically these are tactics that you really need to be aware of and how to use them in order to influence people's perception about the healthcare services that you're offering. So emotions. We say that emotions play a very important role in decision making. Okay, whether it is at the point of deciding what care to take, where should you seek for that care, and whether you're going to adhere to the treatment and things like that. So, as a healthcare marketeer, you need to understand people's emotions and use them to connect with the consumers more deeply. Okay, so this therefore means that you need to employ strategies such as empathetic messaging, testimonials, and then storytelling. Storytelling is an element which I really emphasize a lot. It's a skill that I think everyone should have. Each one of you has a unique story, but how you tell it is the difference. So if you have a patient who has come to your health care facility and everyone thought they are at the end of life, and then all of a sudden the procedures are done and then they come back to life, how do you craft that story to be compelling and connect with people, with people's emotions? It's very, very vital. Do you have a client who has ever gone to your facility and when they have lost hope and then you interview them and then they give this testimony that has an emotional aspect that people who listen to it will get touched, and then you capitalize on that emotional connection that you have created using those perspectives. Persuasion, which I said is a little bit hard to use, but if you craft it well, it can resonate with consumers. Okay, what is very important is not to appear to be too persuasive, and this is where some people may exaggerate. If you're advertising if you're marketing for a given medical procedure, you exaggerate the usefulness of the procedure in that you even fail to mention some of the things that can go wrong with the procedure. And that means that people who understand the procedure will lose trust in you. So trust, transparency, and being honest with all the messaging that you're actually laying out there is very, very important. Okay, so persuasion can work, but you need to be very careful in ensuring that you don't overdo it to erode trust. You can use different channels to do that persuasion: social media, email marketing, website, or even if you have a personalized health applications. For every marketing activity that you're doing, it's very important that you don't give misinformation about what you can do and what you cannot do. Doing the right thing, which involves being professional, being trustworthy, being credible, are very important in every aspect of healthcare, by the way, not only marketing. If you demonstrate that, people will always trust you. And for example, in our setting, do the right thing. The rest, you will not have to talk a lot about what you do. If you do the right thing, you build a reputation. And in our country, there is temptation to get rich fast. There's a temptation to get rich fast. I usually say this story. In the early years of Restore, I received a call early in the morning. Someone called me. I have this amount of money. I want a certificate for this. I will not study, but I want a certificate. Okay? That is a huge temptation. But no, the answer is no. You can't get it when you have not studied. Whether you get asked how much money, you can't. Why? It's because we understand that building a brand is much more bigger than anything. Okay, so doing the right thing is bigger than any amount of money that someone can promise you. And in healthcare, it actually, there are some people, there are some industries where we call them hyperbola, where a slight exaggeration is not bad. But in healthcare, a slight exaggeration is bad because you are termed as a person who is unethical. Okay, so it's very important to be trustful, to safeguard people, patient safety, privacy is very, very key. And in healthcare, and as we shall look at in this session, we have access to health data about patients. But how do we use that data? Do we follow the ethical principles of using that data? And then we also looking at culture and subculture, which we looked at earlier on. I think I will not waste time here, about inclusivity, cultural inclusivity and cultural sensitivity. And I mentioned that it is very important even cultural diversity to be reflected in your organization. This can be in your values, this can be in your recruitment. If you go to a healthcare organization and everyone is speaking a particular tribe, a particular language, then you have issues with cultural inclusivity. And therefore, most likely, what we have as stereotyping will happen to your organization. They will say that hospital is for this tribe. And when that comes, it's about the mind. You remember what we talked about? Perception. The consumers will have perception about your facility. The moment they perceive a given hospital as being a hospital that belongs to a particular tribe, you're finished. Unless you do rebranding, you re-strategize, it will require a lot of resources to change that perception, because you have to change your recruitment strategy, be inclusive, and then your branding, okay, imagery, what we have listed here, okay, respecting cultural preferences and things like that. If you don't demonstrate that, you risk having your organization being branded as one that belongs to a particular sect of people. So diversity is very important. But we also have we have hospitals that provide culturally, for example, we have hospitals that are for specific nationalities, but they still have that element of inclusivity. For example, you can talk. For example, it is not very hard to find, let us say, Egyptian hospital. It's not very hard to find in Chinese hospital. But that does not mean that when you go there as a South Sudanese, that they will not actually welcome you. I hope you get the distinction. So you can have that umbrella name, Chinese hospital, but everyone is actually welcome. Okay? But the uniqueness, which is basically the niche could be nationals who come from China. And perhaps they rely on Chinese medicine or alternative medicine approaches for given diseases. So that could be more of a niche marketing. But also they have inclusive services. So if you go there as a South Sudanese, you can still be taken care of. Okay? And the other thing that you can really do that can put you in good image, or that can create positive perception about your brand, is supporting consumer advocacy. Okay? You don't have to look at people who come to the healthcare organization as people who are basically going to give you money and then they go away. But you also need to understand them in terms of what challenges do they actually face, and then be able to advocate for them. For example, if you have, for example, if you have HIV patients and they come to you for treatment, but since you are a private organization, they buy these ARVs from you. But these ARVs are extremely expensive, and you are the one actually selling them. And they are expensive because the person who manufactures them has put the price to be high. Now, you as the healthcare organization, you can be an advocate for these patients in trying to lobby and advocate for price reduction from the manufacturer of the ARVs. Okay, when you do that, you create a very good perception amongst the population, and that puts your reputation at high, puts it high. Okay, so let's look at the concept of positioning, which we say that is very, very important in healthcare marketing. You don't want to be like the rest. If you want to understand what positioning is, you don't want to be like the rest. You want to be distinct. You want to be unique. You want people to look at you differently. That's what you call positioning. So what do you do to make sure that you have a unique perception as an organization? Why do you actually need it? You want to stand out of the crowd. If you are in the crowd and you behave like everyone in the crowd, no one recognizes you, and therefore no one comes to you. No one seeks for you particularly. When you go to a shop to buy a phone, usually you go there when you have made your decision that I want an iPhone 15. And you know the money. The reason as to why you go there and you say, I want an iPhone 15, and you have the money to pay, is because Apple, the maker of iPhone, is distinct, is clear, crystal clear. Everyone knows what iPhone stands for. If people don't know what you stand for, it's very easy for people to make purchases which look like yours. Okay, so if your hospital is just like any other hospital, someone will ask themselves, why should I really go there when I can go here? Okay, it could be very in small things. It could be I will not go to that hospital because they don't allow insurance payment. I will go to this one because they allow insurance payment. When I go here, I will spend 8 hours. When I go here, I will spend 30 minutes. That's about positioning. So what makes you different from others? If you make yourself different from others, it means you can be differentiated from others, and that creates a unique identity, which you actually want. And that unique identity influences the psychometric parameters that we talked about: perception, attitudes, okay? And these are actually drivers of decision making, okay? So what value do you provide? The positioning allows the healthcare organization to highlight their value proposition. What do you really offer? What value for money are you offering? And how do you communicate that value to your target audience? It's about positioning, okay? So how do you position yourself? Look at the products that you're offering. You see, you can have a maternity hospital, okay? In one maternity hospital, you have a delivery bed as the way of enabling mothers to deliver. In another one, you have more than 10 methods of delivery. You can deliver in a water tub. You can deliver when you're squatting. You can deliver you can even decide the coloring of the walls of the hospital. You want you have a lot of options. But you see, these are two similar hospitals, maternity hospitals, but one has unique options than the other. One is, and this is almost happening in all hospitals in Juba, delivery bed full stop. Everyone delivers on the delivery bed. Okay? Are you going to deliver on the delivery bed, or you're going to deliver on in a bathtub? Or are you going to deliver while on a balloon, a ball? Okay? So what makes your services or your products different? If you do that, then you are okay. Price of value. This is basically based on pricing strategy. Okay? It's not that people who offer affordable costs will provide a bad service. It's not really. But how you critically think about the pricing is very important. This is to say that if in a government hospital, our government hospitals, most likely if you go there, I'm not sure what charges are there now, but you're most likely going to pay like 40,000 SSP informal charges. Informal charges meaning that these are charges where you're not going to produce a receipt for them. That's why you're calling them informal charges. You may spend 40,000 in a government hospital. But what value do you get for that 40,000? Compared to the value that you get when you go to a private hospital and pay $150 for a normal vaginal delivery. I'm not sure how much it costs in the private hospitals currently in Juba for a normal vaginal delivery. Okay, but someone will weigh that I'm paying this 40 SSP. Yes, it is little, but the place is not clean. There is no privacy. Everyone is there seeing. The visitors have nowhere to sit. There are no private rooms. So it is 40. Yes, it is affordable, but it is not convenient. The quality of service is not good. You will not have personalized care. And then you have another one of 150 where at least the privacy is there. You understand that you have at least one doctor attending to you throughout and things like that. And then you have another one which is about $30. Still, the services are offered in a convenient way. And the method of delivery is also according to the choice that you have made. Okay? So that is product attribute or features. You can put stroke product service attributes. And then actually we're on price of value. Okay, so we move to target market. Who do you target? You don't make a mistake of wanting to be everywhere as a healthcare organization. And also, if you look at our international NGOs, we have international NGOs that are in primary healthcare. We have international NGOs that provide primary healthcare, secondary healthcare, and tertiary healthcare. And then we have NGOs that are focused on what we call public health engineering, that is WASH. And then we have NGOs that are focused on livelihood. So that means that they focus on different needs of the vulnerable populations. So the same thing with the market, with the healthcare organization in the aspect of marketing. You want to identify the unique segment that you want to serve and focus on them. Learn them better, serve them better. Okay? If you're going to serve everyone, you may not serve them better. Competitor comparison. Comparison, this is based on direct or indirect comparison with competitors to highlight advantages or differentiate from them. Okay, so you look around who is providing what and then decide on what strategy you have to take. For example, you can have a new hospital emerging next to you to provide services that are similar to yours. But how you make sure that you stand out from them is you marketing and emphasizing the fact that you have been there longer. Okay? It's very hard to compete with an organization which has been there for 100 years. Okay? Customer loyalty, they have built a brand, they have experienced staff, everything. And then they keep making sure that they mention the fact that they have been in existence since 1990. So it becomes very hard to beat them. Okay, so if you know what your competitors are doing, and then you compare them with you, and then you choose the position to take. So that is about competitor comparison. Niche, which we say that highly specialized field, where you provide quality, personalized care for specific conditions. For example, the kidney hospital, I think, what is its name? The kidney hospital in Juba. Who can tell me? I think it is in Arabic. The kidney hospital next to Juba Teaching Hospital.
I think it's called Al-Cardinal, is it? Al-Cardinal?
Yes, Al-Cardinal, yes, Al-Cardinal. It is basically a specialty on niche. That is a niche hospital, Al-Cardinal. Okay, so how do you, what are the things that you need to look at to choose your positioning? You need to conduct market research, which we looked at last time. You need to understand what people think about you. What needs do they have? What perception do they have? Then you sit down and identify the gaps and then craft a strategy that will put you in a very unique position. And then unique selling proposition is you knowing the uniqueness of the services that you're offering, and then be able to articulate that. You can have a very good hospital, very good health workers, good equipment, but this hospital is not known. Why? It's because they don't have that unique selling proposition. Okay? What makes you stand out? What makes your services unique from others? You need to have that. And then communicate that consistently throughout all your communications. Okay? I think it is later on today that you look at what you call corporate communication with Mr. Mwenda. Communications are very, very, very vital. Okay? In the prescription notes, in the medical records, the uniform that people put on, the press releases, the logo, the signpost, everything. Your uniqueness should be there. That unique selling point should be there. Should be reflected in a way. Even if it is not reflected in a word, but it's reflected in the quality of the work that you're delivering. Messaging, aligning the messaging with the overall brand image, okay, and reputation. Okay, this is why I need to have very clear communication and marketing strategies that align very well with the mission, the values of the organization, and then that will be what will portray the image of the health facility in the minds of people. Remember, we are focused a lot on the mind because we know that it's the mind. Decisions don't come from nowhere. Decisions come from, of course, the mind. So how do you influence that mind? Then the mind will think about what they have ever seen. The mind will make a decision based on the emotional attachment they have, or emotional attachment with something that they have seen. Okay, so that's where branding, marketing, and things like that are very important. Consistency is very important. The meaning of this is that, you see, you can't say that you have been providing excellent healthcare services for over 50 years. I mean, you have just started. You have just started opening up the hospital, and you're branding yourself to be providing highly specialized services. But then 2 years out of, along the line, you start to divert. You start to do things that you start to move up and down. So people will not really understand where you are. Consistency is very important, okay? Because it builds that unique brand. It imprints in people's mind. It imprints in people's minds. If you I can use this example that we had a moment where every toothpaste was called Colgate, yet Colgate was not the only type or the only brand for toothpaste. Why? It's because they have been consistent in what they are really providing. So consistency is very, very important. And differentiation, okay? Differentiation, what differentiates you from others is also key. Keep monitoring the market, what is happening, what are your competitors doing, what are your customers doing, what are they saying. If you don't listen, you cannot change, you cannot innovate, and you cannot adapt. Okay, we have organizations that have run out of business. It's only that in South Sudan, when organizations are shutting up business, they do that quietly. And I think the media in South Sudan has not opened eyes to see who's closing their businesses and then communicating that to the public, such that we know what is really happening. But in the neighboring countries, you have big supermarkets closing. In Uganda, for example, there was Wuchumi, which closed. There was I think it was Nakumat, it closed, and a lot of other organizations, betting organizations, for example, Betway, I think closed. So when such organizations close, it becomes part of the news that you can easily notice that this organization has closed. In South Sudan, we are not really commenting on that, but also basically because we don't have a lot of multilateral organizations operating in multiple countries, apart from, I think, we have MTN and a few others, but big multinationals employing a number of South Sudanese is still, we have just a few of them. Okay, now some of these organizations close because they fail to adapt to the market dynamics. This is to say that the market keeps changing, and when the market changes, you as an organization, you need to be changing. Okay, if you don't change, then you collapse, and then you close your business. Okay, so we look at another area, which is establishing long-term relationships with your healthcare customers. The example that I used earlier on, a hospital treating about 4 generations. That's the beauty that comes with longevity. Okay, if you start your clinic in a place that maybe is not really highly populated, but if you consistently maintain your presence there, you have the population growing with you. Okay, and then when the population grows with you, families are growing with you. Okay, after if you had a child who was 10 years, and then after 10 years of your business, this child is 20 years, and most likely this child, you think about marriage or even has a kid, they'll bring that kid to you. Okay, but that kid will not be brought to you if you did not have a good relationship with that 10-year-old child who is now 20 years and has a child and a wife. Okay, so establishing long-term relationships is very, very vital. This is where you have elements of family doctor. Okay, family doctor will be there throughout. Okay, for even generations. Okay, we'll treat the family members, the grandchildren, the daughters and sons, and then the parents or the grandparents. Okay, so in this generation, for everything that you do, be aware that we have shifted away from you having a service and giving it to the customer. No, we have shifted away from that marketing strategy. If you remember the presentation we had on traditional marketing strategies versus the modern marketing strategy. Nowadays, the focus is on building relationships. It's not about you giving me a service. It's not about you only giving me a service. I want to have connections with you. People are interested in being human to others. So it is about relational marketing. Okay? So why do you need those relationships? Of course, patient loyalty, which I've explained, in terms of the patient always coming back to you and will always be referring other people to you. And this is very important in reputation of the organization. The other thing is about continuity of care. If you have long-term relations with your customers, it is easier for the patients to receive consistent, coordinated, and personalized healthcare services. And this reduces issues to do with patient outcomes, it improves patient outcomes, reduces medical errors, and then also enhances patients' experience. The importance of continuity of care. You don't want to provide disjointed care. Disjointed care is the opposite of continuity of care. Disjointed care is where the doctor is here, refers you to medical imaging in another hospital, and then you come back for review with the results. No, that is disjointed care. You want continuity of care, which is easy. It is easy to manage a particular patient within a particular setting than having different settings altogether. It also enhances patient satisfaction, and this is what you will have if you have very strong relationships. So we shall also look at what we call managing customer relations. Okay, what platforms can you use? What tools, what techniques can you really use to manage customers? So how do you maintain this patient loyalty and engagement? It's still the same approaches. Provide good quality care, personalized care, open communication which builds on trust and transparency, and then coordinated care. Okay. You want to get feedback from patients such that you can really improve your services. You can use surveys, feedback forms, online reviews, testimonials, referrals, and retention rate. These ones can give you an idea of what people are feeling about. For the different health facilities I've gone to in Juba, I've not seen where there is a form that I fill about for me to give my feedback about the healthcare services that they have provided. They just leave you to go. But these are very important. How do you improve the services when you don't hear from people? The people that you have provided services to are the ones to give you constructive feedback. And that's why you need all these surveys, online testimonials, and things like that. Okay? Having that connection is very important. You need to have that personal touch with the people that you're serving. If you don't have that personal touch or connection, it complicates it. Okay, I think I've mentioned this over and over again. Let me complete with this topic called customer databases. For customers who come to the organization, you collect data from them, whether it is their name, their emails, their phone numbers, and things like that. So you have database. If you're very organized, you have a database of this content, of this data. So how do you use that to market? You can use that in creating market segments, okay, and also crafting what we call tailored or targeted marketing messages. If you use this database with the appropriate technology, it means that you'll be able to send personalized communication and also offer customized care. It also means that you're going to provide services in an efficient way because you really understand the market. You understand the people who have been visiting you. And therefore, you're actually going to effectively use your resources because your marketing tactics will be more efficient. Okay? Or the calls to action, if that is one of the metrics you're going to have, are going to be higher than if you have not used any data sets. Okay, so using technology in marketing improves all this. So patients will come, you collect data, whether it is the appointment forms that they fill online, whether it is during the admission process, whether it is these surveys that you continuously do. All the things provide you with data. What is very important is that you have to maintain data, patient data privacy issues. and be compliant with the relevant regulations. And if you're going to use this information for any other purpose, the customers should know, and you should obtain the necessary consent from them. Okay? So it is this data that you will use for market segmentation and then be able to use it in your campaigns. Okay? So when you use that, you basically improve the nature of services that you're providing. The metrics will improve in terms of whether it is the conversion rate, whether it is the providing personalized communication and things like that. You leverage that. Okay, I think we can end here for now, unless you have any specific questions.